Okay. What happens here is, see, just imagine you have a closed space. This is your bone. Bone is a closed cavity. Okay. There is inflammation here. Okay. Inflammatory mediators will come from the blood supply of the bone. Okay. So there'll be excessive inflammation here. Correct. Excessive inflammation, fluid stasis, pressure will increase. So it is supplied by blood vessels, right? Here, here, here. Since the intramedullary pressure increases, the blood supply will start getting decreased. So when the blood supply starts getting decreased, there'll be vascular collapse. These things will start collapsing because of the opposite pressure. So because of the opposite pressure, when the vascular supply is not coming here, so then what will happen is you will have the blood vessels will not supply the periosteum as well as the endosteal layer. That's when they will be starting to have openings like this due to necrosis in the bones. That is what is called as fistulous tracts. So fistulous tracts means there is connection between the intramedullary and the extramedullary space. Okay. And this will have a skin outside, right? This will have a skin outside, right? We tend to have the periosteum and the skin, muscle layer, all this will be there. This will have a swelling now. And there'll be a point of weakness which will be seen as red and inflamed and excoriating. If you put a needle prick in this, there'll be a lot of fluid from the sinus tract and it will form a fistula from the bone intramedullary cavity to the external space. That is the mechanism of formation of fistula.